Hello, everyone. Good evening, everybody. I'm Priyanjali from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is benign prostatic hyperplasia, or what we commonly call as BPH. Benign prostatic hyperplasia, or BPS, which is the non-cancerous enlargement of the prostate, which usually begin in 50s in men, and which in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and it is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor, such as a urologist, can treat this condition and help the patient to get relief. To more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Pravesh Gupta, MBBS, MS, MCH Urology, and Renal Transplant Surgery. He has
Yes, good
rich
evening.
experience. Yes, so he has rich experience and hands on expertise in stone management as well as in treating urological problems. He's currently practicing at Apollo Spectra Hospitals, Gwalior. Dr. Pravesh Gupta has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. And with that, I would like to welcome him to today's platform. A very warm welcome to you, Doctor. Let's start with what is BPH in your language?
Good evening, everyone, and your viewer and listeners. So, first of all, I would like to thank you for giving me opportunity to discuss about this important topic, which is very much prevalent in our society nowadays. So, BPH is, as you told already, it's a benign enlargement of the prostate, which happens almost in each and every man, usually after the 50 years or 60 years of the age. It's a non-cancerous enlargement, as we know. So, because it's just related to size, so it produces some specific symptoms, which we'll discuss in our talk going on. So, it is a common condition in our society, seen in the man, and it can be dealt with some modern medicines, and there are many surgical treatment options also available, which we will discuss definitely.
Right. Now, speaking of the cause behind it, as we have already known that it is very common amongst the men, and everybody at some stage in their life will be facing it. So, what is the basic cause behind it?
See, the exact cause we cannot ascertain to some specific deficiency or condition, but usually it is a
Mm-hmm.
part of the aging process at the age advances in the man. So this process happen, some hormone levels goes down in the man after the 60 year particularly, the decline in the testosterone levels and slight rise in the estrogen levels and certain dietary habits. So so many factors are there involved in the increasing the size of this prostate gland in the man. So these all factors contribute all together, and this results in the benign enlargement of the prostate.
Right. Now, doctor, in case of any disease or any condition, as we are talking about, BPH is not a disease, it is a condition which we have to
Yes.
deal with and which everybody's will face in at some point in their life. So, identifying the condition in an early stage can somehow bring a point of relief for the patients, also for the doctors. So, how does one patient know in the early stage that this is BPH? And this is the right time to visit the urologist. What are the early symptoms?
Yes, yes, that's very good question actually. Because initial days only, if the patient is able to detect or consult a urologist at the time, so it is very easily manageable without any complication. So the common symptoms which are usually ignored by the patient or the person in the early phase, these are the frequent urination. There is strong urge to urinate, unable to hold the urine, especially when outside in public meetings. Then recurrent UTI, urinary tract infections, and other is the coming seeing the blood in the your urine, and some stream flow of the urine when it starts getting decreased, the flow is not so good. So these are all the early symptoms. So what we told that frequency, urgency, and the poor stream, poor flow, then recurrent infection and blood in the urine. These all are the common things which can be detected early at the early stage if someone is very watchful. And another particular that important symptom is the nocturia. That means if you have to go out of the bed in the night and have to disturb your sleep and just to go to toilet. So if it is more than two times, then it is significant and it is termed as nocturia in the medical terminology. So nighttime frequency, if it is increasing, so someone should not take it as a lightly. And these are the early symptoms which can be due to the benign prostatic enlargement.
Right. Now speaking about the symptoms which you have already mentioned, nocturia, unable to hold the pee for a long time. So aren't the similar kind of symptoms, don't we get to see the kind of symptoms which you have already mentioned in diabetic patients as well? So how does one differentiate between the two?
Yes, yes. Very good question again. Because similar kind of symptoms can be seen in not only in the diabetes, but certain other medical condition also, like in
Hmm.
some
Right.
neurological conditions also. And if there is some urinary urethral stricture also, it can be the similar kind of scenario can be there. So from the diabetes, as you know, means if usually diabetic patient they are diagnosed before, and the one knows already that he is a diabetic and already on the medications. But the in the diabetes usually it is the predominantly the urgency or the this poor sensation symptoms will be more prevalent. The flow of the urine usually won't be affected early in the diabetes, and there will be some other changes in the body like in eyes and the kidneys. So there are some other organs also affected in the diabetes, while for the prostate enlargement usually there are mainly the urinary symptoms, and most of the time the patient who do those who visit to the OPD, they come with the because of poor flow, because they have difficulty in the urine, they have to force to urinate. So predominantly they seek the medical advice whenever there is a obstruction during their urinary flow. For the urgency and nocturia, usually they don't take it so that seriously. They tolerate that symptoms very well, and usually if it is not bothering their life much, they don't seek medical attention at that time.
Right. Now that we can differentiate between the two, diabetes and BPH, doctor, what is the diagnostic procedure? So, what is the first thing that we do when a patient comes to us and he comes back to with such sort of problems that he is not able to hold the pee or nocturia, as you have already mentioned? So, what is the first thing we suggest them?
See, when the patient comes with these symptoms which we have discussed already, so first we have
Hmm.
to take a detailed clinical history, like you told, whether he is a diabetic or some neurological problem or hypertensive, some cardiac issue, or whether he is already taking some other medication for some other illness. So these all things need to be taken in detail. Then starting for the evaluation, we have to see some basic clinical test. During the physical examination, digital rectal examination is the important thing which we need usually we do. So this examination gives us the some clinical assessment and gross idea about the size of the prostate, and then we see the other tests like ultrasound just to see the prostate size and to measure the volume of the urine whichever he is holding before and after the void. And then we do can do uroflowmetry, this which tells us about the how much is the flow of the urine and whether he is generating any force. The pattern of the uroflowmetry help us in detecting the underlying problem, whether it is purely due to the obstruction only or it is some the lack of force is there from the bladder side. So these are the routine investigations. Apart from this blood test also like CBC, RFT, renal function test. So usually we do what we discussed, digital rectal examination, then urine routine analysis, and this uroflowmetry, then ultrasound with the post-void residual to assess the prostate size. These are the basic minimum tests we do in the OPD.
Right. Now, coming back to the treatments which are available, we know medical science, it has evolved a lot with time. So there are a lot of options which are available currently. So what for the first level of patients where the symptoms are very mild? So how do we treat the patient in the first stage?
See, for the very mild symptoms, we just advise them some medical treatment, and usually we advise some sort of lifestyle changes and some uh, behavioral changes like doing some exercise, adopting a healthy lifestyle, and if the person is alcoholic or smoking, so we advise to quit and abandon all these activities. So usually patient with the milder symptoms, they respond very well to the medical treatment, and there are very good class of drugs are available. So patient usually respond very well to these medical, and majority of the patient, they usually fall under this category only, and most of them, they require just a medical treatment and some lifestyle changes, and they are usually very well maintained for the throughout the many years, and they do not require any surgical or any further intervention most of the time.
Right. Doctor, you said that changes in the basic lifestyle can be very much helpful. So we are saying that lifestyle changes is one of the major reason why BPH occurs. So what kind of lifestyle changes can we start from? Can we discuss about a few of them?
See, adopting a healthy lifestyle is actually very important, not only for the prostate, but so for so many other
Mm-hmm.
diseases also, like for your heart, your kidney, your liver. So overall, a person usually should carry a healthy lifestyle. You should have a good nutrition, should do regular exercise, keep them fit. That is the most important key for the health. For the prostate specifically, if we discuss, so usually the pelvic pelvic muscle floor exercise, or the Kegel exercise, we can say, in the form of
Right.
yoga or some exercise, that is very helpful actually. So usually it helps in building the pelvic floor muscles around the prostate. So
Mm-hmm.
especially in the patient, those who are having more kind of urgency, frequency, and they are having poor control in their urination, they are not able to hold the bladder. So in these kind of situation, these kind of patient, usually this kind of this exercise, yoga, Kegel exercise usually helps. But in certain set of
Right.
the population, because of it is a very large size prostate, so these things, these are usually not enough, so we have to give some medications also.
Right. Now, coming back to the medications, doctor, what about those patients who has delayed it for some time? What are the options for them? What are the medical options which are available? Also, tell us, can consuming these medicines for a long time, can these have any adverse effect on our health?
Yes, we have a very good category of the medications available nowadays for this problem. And as I told, that majority of the patient, they usually fall the mild symptom category, and they very well respond to the medical treatment. So usually in our medical this thing textbook, the class of drug known as the alpha blocker, means those who block the particular receptors over the prostate, which is alpha receptors. So these kind of the medications, these are predominantly in the use for the long years for the treatment of the prostate, and most of the patient, they respond very well to it, and they have very few side effects also with them. But most of the time, these effects are very well tolerated, and the patient usually don't have any major issue. It's very rarely we have to stop these medication because of some adverse issues or some side effects. But most of the time, the patient usually tolerate it very well, and they respond to the treatment, and the symptoms usually improve. Then another class of the medication which we have are these are the anticholinergic medications, which are given usually for the patient those who are having difficulty in controlling their urine, or those who are having very high frequency and nocturia is very high, means they are getting out of the urine in the night every hour. So in these kind of the patient, there are this kind of this category of class of drug which I told anticholinergic. Usually these drugs helps. Then another class is PD5 inhibitor category. These medications also they are nowadays it is used. This is the newest category, and this is also helpful in increasing the flow of the urine in the BPH patients. So these are the three main class of the drug which are used for the medical treatment in the BPH patients. And we have very different permuted combinations of the all these three drugs. Many companies they are coming up with different permuted combinations. So treatment can be titrated or specified or personalized according to the individual what predominant symptom he is having. So accordingly we can give the combination of the two class of the drug either in a single tablet form or the combination form. So there are good medication and usually very well tolerated, and usually patient get much relief after taking that.
Right. Um, Now, let's move ahead a little bit more than medication. What are the surgical options which are available for the patients who have to opt for surgery?
See, usually we advise the surgery for the patient those who don't respond to the medical treatment, or those who are having some complication because of the enlarged prostate, like their renal profile is getting deranged, or they are having recurrent urinary infections, or for those who are having the recurrent hematuria, means blood coming out of the urine. So for these kind of the category, we usually go for surgery. Or one more patient, those who are having acute urinary retention. So if the patient is have gone undergone at some point of time have acute retention of the urine, that is a clearly indication for the surgery. Or and definitely the patient those who are not responding or poorly responding for the medical treatment, also the candidate for the surgery. And there are so many surgical options available. In the past, we used to do open surgery, which was done after giving an incision in the lower abdomen and opening your bladder or opening through outside the bladder and removing the prostate after dissecting. And that used to have a very good amount of the blood loss, and patient usually used to have more stay in the hospital, and there was a long incision over there in the lower abdomen. So there were some problems with that surgery. So nowadays, it has revolutionized the complete surgical treatment. The technology has revolutionized it. So we do totally endoscopic surgery nowadays. So there is no cut or no any incision is made over the body. It is done through the passage of the urethra. We put an endoscope inside and we remove the enlarged part of the prostate in the piecemeals in the small pieces. And we have various technologies for that. Either can use electric current for the doing the job, or we can have bipolar cautery machines, which is equally good. And the latest is the laser, so which is giving the much more relief and much more uh, benefit to the patients. So these are the
Right.
surgical options we have discussed. We can discuss it further in detail also.
Right. Doctor, is it also possible that the patient is not showing any sort of symptoms and he comes with a different, altogether different issue, and then the doctor diagnoses the patient with BPH? So, is it possible that the patient does not have any sort of symptoms, the kind of symptoms which we have already talked about, but he's still suffering from the condition?
Yes, this can happen, but usually, if patient is not having symptoms, and after even after evaluation, if his flow is good and he is not going to urinate frequently, and he is taking good sleep, and flow is good, so mere increasing in the size of the prostate is not an indication for any treatment, medical or surgical. only for the symptoms. If the patient is having the problem in the urine flow, if he is having any of the symptoms we have discussed, then only he requires the treatment. If he has come for some other treatment, for some other illness, and simultaneously the report is showing the enlarged prostate, but at the same time he is not having any problem, any sort of problem related to the prostate, like he is not going to bathroom frequently, and flow is also good on the uroflowmetry, although we need to evaluate him, and other tests are also normal, then usually they don't require any kind of any sort of treatment, but they are told that you are having a large prostate in your reports, and in the later life, if you are experience any of the symptoms which you have discussed, so just please come to us and follow us, and we will investigate you further, and we will start some treatment. But if at present, if he is not having any problem, he is avoiding very well, and just only because the report is showing the enlarged size in prostate, so that doesn't mean that he needs any surgery or any medical treatment.
Right. Also, doctor, what is the rate of recurrence if you are talking about BPH?
See, recurrence is usually occurs after the 10 to 15 years after the surgery, because as I told that surgery is done endoscopically. So as we go inside the urethra and we remove the part which is blocking the passage, that much part only remove usually. Apart from that, maximum whatever in the so it is never a complete prostate is removed with this technique. For that, we need some major surgeries like radical prostatectomy or robotic prostatectomy. So usually, whatever amount of the prostate that is left behind after the surgery, it regrows after the 10 to 15 years. So recurrence can be there in after a certain time, but usually the patient they are undergoing the surgeries are mostly the 60 plus age year group, and by the time it will regrow, usually they are 75 or 80 plus, so life expectancy usually is not much more in that after that. So they most of the time they don't come for the this thing. But yes, if someone has undergone the surgery at the earlier stage, so usually these kind of patient they come with the recurrence, and they need the same surgery.
Right. Uh, so now coming back to the kind of lifestyle one should maintain in order to prevent, because I know a lot of people will be asking for the preventions. What are the kind of preventions one can take to stay away from it? We are again and again saying that no matter any any situations you are in or any kind of body you have or some people might think that they have a great immunity, so no matter whatever circumstance you are in, there will be a phase or there will be a age where you will be into BPH. So, but still, doctor, is it possible to delay the symptoms if anybody wants to? What are the kind of preventions one should take in order to delay the symptoms?
I think part of it we already discussed that just to maintain healthy nutrition and your regular exercise, keep yourself fit, and maintaining a healthy lifestyle, and not indulging into the activities like alcohol and smoking, tobacco intake. So these all things they this can contribute to the healthy prostate life also, and also important is to regularly get yourself checked by the urologist. If you particularly you are thinking about the prostate, just once in a year go to your urologist, do your regular checkup, all the tests done, your uroflow, your urine examination, serum PSA also, which we didn't discuss, because that is the test which should be offered to everyone above the 50 years of the age. That is done for the prostate cancer screening. But anyway, we are not discussing prostate cancer today, but that is also the part of the evaluation in the BPH. So, apart from maintaining a healthy lifestyle, one should go to consult a urologist every once in a year at least after the age of 60 years, so that even if there is some symptom, if and he is not able to notice or perceive the symptoms as a problem, so doctor can identify it as at a early stage, and if it is required, then they can start a treatment also for the same.
Right. Now, speaking about physical exercise, we know the importance of it in our day-to-day life. What about the patients of BPH? What kind of exercise do we suggest them, or can they just maintain the regular lifestyle that they are maintaining after the surgery?
You are asking the exercises which can advise after surgery, or you are asking
After
for the
surgery,
prevention
after
after surgery? Okay.
no, not for
Usually,
prevention, but
immediately.
after
Okay.
surgery.
Yes, yes, I got it. So after surgery, usually for initial 1 to 2 months, we don't advise any kind of exercise because the
Mm-hmm.
patient usually they are advised to avoid any heavy or strenuous activity because post surgical there is a risk of some bleeding and all. So we usually
Mm-hmm.
advise them to take some rest at least for 7 days and then do some light activity only for the next 2 months. After that, if they want, they can do the Kegel exercise, which we discussed, that is the pelvic floor muscles
Right.
exercise. So, which is usually very helpful for the man for reducing the operation related this discomfort, and for the in the future also, if they are having the going to have some issues related to the prostate, that will also improve. And the surrounding muscles usually they get some good support, and usually overall their experience of the surgery that will improve if they do the exercise.
Right. What about yoga, doctor? There is a huge craze of yoga nowadays amongst us. So, can yoga be helpful for BPH as well?
Yes, yes, definitely it can be helpful because in our yoga also there are certain asanas. I don't know, and please don't ask about that because I don't know in the detail about yoga. But they say that there are particular asana, especially for the prostate and pelvic region muscles. So definitely, it is not scientifically proven. We can say directly we can link it to the prostate health, but anyway, it is not going to harm anyone. So there is no harm in doing that. And we also suggest, and whatever the activity exercise you are doing, it will be good for your body overall. So
Right,
one can go with that.
right. And what about the diet? What kind of diet should one follow in order to prevent themselves and also after surgery? Are there any changes in the diet?
Usually, after surgery, we advise the patient to have some easily digestible food, which is rich in fiber, and we usually ask them to avoid some high protein or heavy spicy foods, which usually can cause some irritation or some sort of constipation. So we advise them to avoid constipation and ask them to just nutritive and good fiber-rich diet. That is usually enough, which should be easily digestible for them. Anything they can take. There is no particular.
Right. And what about the water intake? How important is hydration in the entire process?
You're asking about hydration.
Yes.
And the hydration is very important because this is related to the your urinary part, urinary system. So entire the health of from kidney to your prostate, it is well maintained only on the hydration. So obviously hydration it should be maintained and it is required. One should have enough adequate amount of the water on daily basis. Usually for a healthy adult without any existing illness of the kidney or some other, it is 3 to 4 liter of the water intake is it sufficient in 24 hours. And but the patient with the prostate, those who are having the nighttime frequency, we usually advise them to avoid the drinking water before 2 hours of the sleep, so that the urine formation is not much in the during the night hours, and they don't have get out of the sleep or bed for the urination.
Right. I know a lot of people because we are from India and we love our tea and coffee. So there are also patients who like their evening tea or who likes having tea before going to sleep. So can those drinking tea and coffee at any point in their day also somehow trigger the condition? Should they control this?
Yes, 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 exactly. Very good question and very commonly asked question also in my practice. So
Mm-hmm.
usually the patient, those who are taking coffee or tea. So on a regular basis, at regular time, 1 or 2 cups in a day, usually it is not a problem. But the patient, those who are having frequency symptom and nighttime frequency particularly, they should avoid taking tea or coffee in the late evening, especially before the sleep. As I told that before 2 hours of the sleep, they should restrict all the fluid intake. So that also include the coffee or tea intake also. Late evening, they should not take. Even in the daytime, if they are experiencing much more frequency, urgency after taking any sort of coffee or tea, then they should restrict it. But most of the time, in the daytime or in the morning hours, 1 or 2 cup of the tea or coffee, usually it is tolerated very well. They don't have that much of difficulty or symptoms after that. But excessive drinking tea and coffee, it is usually it is should be avoided for the prostate patients.
Right. Well, these are few things which we need to keep in mind when we are talking about BPH. We have discussed a lot of things today, a lot of basic things today, which, when changed, can bring a larger impact in your life. With that, I can see a few questions coming up from the viewers. The first question comes from Ajit Singh, who asks, are there any vaccines that can prevent BPH?
Sorry, there is no such vaccine. There is vaccine trial that is going on or certain available also, that is for prostate cancer, not for BPH.
Hmm.
We are discussing today here is non-cancerous condition, that is benign prostatic hyperplasia, not the prostate cancer. So vaccine is available for the prostate cancer treatment, but not for the benign prostatic hyperplasia.
Right. But just for knowledge, doctor, what if somebody is delaying the condition? If it's not been treated for a long period of time, can it turn cancerous? Is it possible?
No, usually it is not like that, and there is no data or any study which supports this kind of theory, that if it is not treated, if we don't treat the benign prostatic hyperplasia, then it can convert into the cancerous condition. Usually, the
Hmm.
cancerous prostate, by default or since beginning, some element is there. So it is there is no proof or there is no data to support this theory that benign prostatic hyperplasia can be converted into the prostate cancer. Prostate
Right.
cancer by itself, it's since beginning, it is a different entity, and those who are on having the benign, it is a totally different entity.
Right. But is there any genetic
Yes, yes,
disposition
definitely,
that we get to see?
definitely. Yes, yes. Yeah. If in the family, your father, your uncle, or any other in the first degree relatives who had this prostate cancer, then is definitely there is chances that the person is having the risk of the prostate cancer in later in his life. And these kind of patient with the family history, they should be screened earlier at the stage for the prostate cancer, and screening should start after the 45 years of the age. And as we discussed, that serum PSA is the best test, and consulting a urologist for the physical examination, digital rectal examination, these all things help in the early detection of the prostate cancer, because the prostate cancer is one of the few very rare cancer which is very well treatable condition nowadays, because of the advancement in the medical field.
Right. Uh, yes, anybody who gets to see the condition in their family, please make sure that the prevention should start at an early age. Start improving your lifestyle, make small changes, drink sufficient amount of water. Make sure you're giving yourself some time. Eat home cooked food. Avoid junk, which is very basic, and of course, alcohol and smoking. We are talking about it repetitively today. So the basic lifestyle changes which can anyway improve your health, those are the only thing you can do to yourself in order to delay the condition. We are again saying that it's not like you won't be hit by it. Everybody is getting it at any point of time. We can just keep it under control. The next question, doctor, comes from um, Pijushri, who asks, can herbal supplements prevent BPH?
Yes, there are certain herbal supplements available, not only in India, abroad also. In USA, there is some herbal supplement, saw palmetto, which is being popularized and used very widely for the BPH prevention. and treatment. So, and in India also there are certain herbal products are there. Usually we don't prescribe because there is not a sufficient data or any strong evidence to support the treatment with the herbal medication. But there are a lot of herbal supplements are they are available. So, but they are of very limited benefit, and usually the symptoms which we are discussing they don't get relieved by them. So most of the time, patient needs some sort of medical treatment either in the tablet form or surgical treatment only. But yes,
Right.
we can
The
try
next
for the herbal supplement. Yes. Mm.
Right. Yes. As mentioned, that there are herbal supplements which can prevent the condition. So please make sure you are doing a proper research, or please we would always suggest to get it under an expert's guidance. Please don't take it for yourself. Make sure you're visiting the expert for any sort of things which you are doing for your health. Make sure there is an expert advice behind it. The next question, doctor, comes from Yash, who asks, Doctor, can BPH treatment improve sleep quality?
Yes, definitely. Because most of the many of the patient, those who are getting nighttime frequency, they are actually not having the good quality sleep, and various sleep disturbances are noticed in them. And even the obstructive sleep apnea is seen associated, and certain cardiac condition also linked to the BPH. So BPH can impact your overall health, not only just by the urinary system, but also in the sleep, in your cardiac health, and your respiratory health also. So definitely, so treating the BPH will improve all these things if it is there. So, and sleep also, as you asked, so it is required. The treatment is required for the better sleep also to increase the sleep quality.
Right. The next question, doctor, comes from Abhi, who asks, can BPH return after prostate surgery? Recurrence.
Yes,
Yes, the same
yes.
kind of.
Already we have discussed that it can recurrence. Recurrence can be there after the surgery, but usually it take around 10 to 15 years or even more. So by that time, if the patient is very active, is ready to go for surgery, then usually it is the surgery is done. Otherwise, most of the time it is managed with the medical treatment also again.
And the last question for today, doctor, comes from Anuj, who asks, can BPH cause lower back pain?
Yes, see, benign prostatic hypertension as such do not cause directly back pain. For the back pain related to the prostate, there can be the most commonly the two scenarios. One is because of retention. If the patient is holding urine for a longer period, and bladder is holding urine for the long capacity more than, and chronic retention is there, large capacity bladder, so it can put some pressure over the back this thing nerves or muscles, and so patient can have some sort of low back pain. And another is the prostate cancer. In the scenario of the prostate cancer, so prostate cancer usually it can spread into the vertebra at the lower back region. So lower
Right.
prostatic enlargement with the lower back pain, and this can be a indication to screen for the prostate cancer, because it is common with the prostate cancer. Usually with the benign prostatic enlargement, it is very less seen.
Right. Well, I believe, Anuj, you have got your answer. And with that, Doctor, we had a very informative session today for our viewers. Before we take a leave, any take home message that you want to give our viewers who has watched us so far?
Yes, first let me thank you and your viewers for the
Thank you so
uh,
much.
this kind interactive session on the BPH, and it was really nice to interacting with you all. So the take home message will be that whatever we have discussed today about the BPH, if you found see any these symptoms, these kind of problem in your surrounding, in your at your home, in your society, and your place, so just spread the knowledge. Just ask your elderly. Just see what is the pattern they are following, how much time they are taking to urinate, how frequently they are going, whether they are going in the night, how many times they are going, they have to get up from the sleep, because many a time they won't be telling you all this. Usually they feel ignored, and they take the things for the granted with the advancing age. So this is our duty to seek these kind of things, and just pay attention to their health. And if anything is there, just bring them to nearest hospital or urologist and get them evaluated, so that the treatment can be started, because it is a very common condition, and most of the time it is getting equally ignored also. So whatever you have learned or you have understand from the today's session, just spread the knowledge and just make the society better.
Well, that was the expert advice for today, and that was Dr. Pravesh Gupta for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Okay, thank you.